Hello everyone. I just wanted to brief you on the work we have been doing this week for the World Health Assembly. You're probably aware it's the first time that it's been a virtual World Health Assembly. But I also think it was a first because the Director General in his introductory remarks spoke specifically about nurses and midwives, mentioned that this is the year of the nurse and the midwife, acknowledged the work that you are doing, and then led all member states in a round of applause to thank you for what you are doing. The World Health Assembly focused specifically on coronavirus, and many of the member states talked about their experience, the work that they were doing, and also talked about the work of nurses, midwives, and the health workforce. There were many things that they said which are important, which we had been calling for, about increasing the supply of personal protective equipment, about prioritising and protecting the health workforce, about looking after your mental as well as your physical health. But I'm afraid they didn't go far enough. In the ICN intervention, we called for the standardised collection of data in relation to health worker infections and deaths. Tragically, we are seeing numbers rise on a daily basis. The numbers of health worker infections now runs into hundreds of thousands, and I'm really fearful that the number of deaths of nurses could run into the thousands. This isn't collecting data for data's sake. It will add to our understanding of the virus, it will protect you, and it will save lives. ICN is not going to stop recording and reporting on this information, and we will continue with our advocacy that all countries should collect this information on a standardised and systematic way. The World Health Assembly has featured on news programmes right the way around the world. That's not surprising. We're in the middle of a global pandemic and health crisis, and we need a strong and coordinated global response. If we didn't have WHO, we would need to create it. But that doesn't mean that any organisation, indeed any country, is perfect. We need to evaluate, we need to learn in order to strengthen our health systems. This isn't about blaming, it's not about finger pointing, but it is about making sure that the legacy from coronavirus is much stronger health systems. And WHO committed to undertake that evaluation. We are only as strong as our weakest link. And like it or not, our destiny will be a shared one. But for nursing, we have our roadmap. We have the State of the World's Nursing Report. It says very clearly we must invest in nursing education, nursing jobs, and nursing leadership. Let's not lose sight of that over the coming months.